From KETK, you're watching East Texas Live.
And welcome back to East Texas Live on KETK. Joining us now is Dr. Schwarzbach from Azalea Orthopedics, who is a board-certified physical medicine and rehabilitation physician. He's here to tell us about their specialties, about EMG and nerve testing. Good morning. Thank you for coming.
Good morning. My pleasure.
All right, no problem. So kind of just starting with a brief overview here. Tell me about your specialty that you provide at Azalea Orthopedics.
Sure. So I'm a physical medicine and rehabilitation physician. We're also called physiatrists. And I treat any kind of neuromusculoskeletal problem. I do a lot of nerve tests, also treat shoulder pain, knee pain, elbow pain, hip pain, back pain, do spine injections, and also, of course, the nerve test is a big part of what I do.
All right, so very important to have here in East Texas. So what exactly is EMG and nerve testing?
Yeah, so EMG and nerve testing is, it's a two-part test. The first part is where we take a small electric impulse and give a light electric impulse and record the responses. And based on those responses, I can figure a lot of things out. And then also the second part of the test is actually the EMG portion, and that's where I take a very tiny sterile disposable pen. It's not hollow like a needle, it's much smaller. It feels like a little sticker burr. And I check the electrical activity of different muscles and help determine, other kinds of conditions that we can treat.
All right, so definitely very important here in East Texas. So who would be a good candidate for this type of testing?
So I would say people with numbness, tingling. Of course, we check both the upper extremities and lower extremities. So in the arm, it is a test we use to confirm whether someone has carpal tunnel syndrome, like a pinched nerve at the wrist, or a pinched nerve at the elbow. So numbness and tingling in the hand also helps differentiate whether it's a peripheral nerve compression, like the median or ulnar nerve at the wrist and elbow respectively, or if it could be a pinched nerve in the neck. So it helps to detect those differences. So I'd say numbness, tingling, pain, weakness, yeah. Okay,
so there you go. So how do your patients benefit from this testing?
So I'd say the more specific the diagnosis, then you can treat it best, because you need to know what exactly you're treating. So the test helps to differentiate what the problem is.
Okay, gotcha. So do you ever diagnose patients with difficulties that have a normal EMG/nerve conduction study?
Yes. And I'll back up and touch more on what all we find, but there are times where, I do a study and I realize, well, the study is normal, but I realize being a physician and, what the problem might be. For example, like multiple sclerosis is not a test that usually shows up on the, a condition that shows up on the test, but yet knowing the signs and symptoms, I may get like an MRI of their brain and cervical spine or be able to otherwise diagnose the problem. So I think it's good to have a physician doing the tests, because then even if the test is normal, they're thinking, okay, what else could this be? As far as the, the conditions we diagnose, a lot of times it's, like for example, a pinched nerve like carpal tunnel or ulnar neuropathy at the elbow, or peripheral neuropathy when the feet are numb and tingly. Unfortunately, sometimes it can be a more serious thing. Not too long ago, I had a patient sent to me just to do a nerve test on one leg because they had some weakness, but just in doing the test, I could tell there was much more going on. So I had to do more extensive testing and at that time, and realized the person had Lou Gehrig's disease, ALS. So that was a very tough situation. But so there are quite a variety of things we can pick up on the study.
All right, so yeah, definitely very important to have here in East Texas. Always important to get checkups as well and things like that. And if you want to find out more information, you can go to azaleaortho.com. Thank you for being here, and
absolutely,
we'll have more news and weather for you after the break.
All right, great. Thanks.